Stop doing upright rows or things with your thumbs down to get good shoulder strength. It's probably crushing your results. In this video, I'm going to show you why this is happening and what to do for long-term health for your shoulder. What's up guys, Dr. Nippon Forte here to talk all about the shoulder. In this video, we're going to be really focusing on shoulder impingement syndrome. That's a very catch-all term to encompass many things that could be going on at the shoulder. Syndrome is really a combination of things that are contributing to the actual issues. So when we're talking about the shoulder, we have to figure out what we're actually talking about and the structures that live at the shoulder. So we have our shoulder blade, we have our arm bone, clavicle, and then we have muscles and tendons and bursa that all come into the shoulder. So if we go deep into the shoulder, we have two rotator cuff muscles on the back, one on the top, which is called the supraspinatus, and then one on the front, which is the subscapularis. Now on top at the shoulder, we have the supraspinatus tendon and then a bursa in the shoulder. Now depending on anatomical variations at the shoulder blade, you could have different forms of how the structure of the shoulder blade is, and that can limit the space of your shoulder blade and your arm bone. So we have to think about the shoulder blade being the roof of the shoulder joint. So the shoulder blade is the roof and then the arm bone is underneath it. Now depending on how the shoulder blade is actually developed, it could be hooked or it could be another form of this, which can predispose your body to more limited space at the shoulder joint, because we have our arm bone, then we have the bursa and the tendon right here, and then the top of the roof. Now depending on other factors like postural positioning or mobility deficits, all of these things can contribute to the limited space at the shoulder joint. Now when their space is limited at the shoulder, it could then predispose us to more factors like pain and irritation from happening. When we raise our arm up, we close on that gap between the arm bone and the shoulder blade, or the roof. Now, if structures are inflamed, like the bursa, or you have irritation to the supraspinatus tendon, that's when these issues can cause some discomfort when we put our arms in certain positions. So with that in mind, if we zoom out and we think about things that we're doing in exercises, we can predispose our body to positions that are irritated. Now, if they're irritated, we have to figure out what causes those things and factors that contribute to that, like mobility issues, strength issues, posture. Work on those things, at the same time modify certain exercises you're doing, and then that's how you build a strategic way out of this stuff. Now in this video, we're going to be looking at it from a mobility perspective and a strength component here. Now when we talk about from a strength component, we have to look at what the shoulder blade can act on the arm bone. So muscles that act on the shoulder blade are the lower trap muscles, the serratus muscle, and other muscles. We're going to be focusing on the lower trap muscle in this video, and then the rotator cuff muscles as well. And then from a mobility standpoint, we have to look at shoulder internal rotation, because when we do things like we're raising our arms up with our thumb down, that will be in an internally rotated position. Also, with upright rows, we're in an internally rotated position. If we lack motion into internal rotation and we predispose our body to those positions, if we don't have that range of motion, it's already setting us up for more impingement-like symptoms causing irritation. So on the back end, we have to improve shoulder internal rotation so that we can actually start to then progress and have the ability for our shoulder to take on more things in a different range of motion. Now let's look at the ones that you actually might need to focus and prioritize on. Let's do a test for internal rotation, and let's do 2 strength tests. For shoulder internal rotation, you just get on your back and you put your arm by your side at a 90-degree angle. You keep your arm at a 90-degree angle at your elbow and your shoulder, right? So if this was down, that wouldn't be 90 degrees. You wanna go straight out to the side. Now from here, you just wanna rotate down as far as you can until you feel stuck, like you can't go any further. But there's a lot of mind-body connection with this, because we can go like this, but it's a clear compensation. We wanna just think about rotation happening. So mind-body connection of actual rotation versus just going down like this. So you want your elbow like this, and you want to just focus on pure rotation like this. So right around here, that's where I feel stuck before my elbow has to drop down like this or my shoulder just dumps forward like this. So you want your shoulder down and pinned down to the ground and just focus on rotation without moving the shoulder up or the elbow dropping down. A good thing you could also do is put your hand, your free hand, on top of the shoulder, and as you go down, if you start to feel like the shoulder is putting pressure into this top hand, that's where you would stop, because you know you're just dumping forward. So you want to go pure rotation, and then you get a screenshot of this from the side of you and see if you're getting a roughly that 60 to 70 degree angle as you go down. If this was 0 right here, you want to go down into about a 60 to 70 degree angle right around here. Test 2 and 3 is going to be face down, and you're going to be working on shoulder external rotation and biasing the lower trap muscle. The lower trap muscle is on the back of our body on an angle. And if we raise our arm up like this into a Y position, we're gonna bias that lower trap given the fiber angles of the muscle. From an external rotation standpoint at the shoulder, we're gonna be here and gonna go straight up, going into shoulder external rotation, and we'll hold that position to bias the rotator cuff. So the rotator cuff test, you're face down. If this is the ground, you could be like this, but if you're on the edge of a table, you could also rotate up like this and hold it. So imagine if you're just on the ground like that, you would just lift off and hold. So from here, I go up, and I'm just gonna hold this position, and I wanna see how long I could hold this position off the ground until I have to just drop, and or my arm just starts to compensate down. So you wanna keep your forearm parallel to the ground, and just hold this position. What you're aiming for time under tension is anywhere from 30 seconds to a minute. That can give you a good indication that you have good strength at the rotator cuff. If you feel a lot of fatiguing happening or cramping happening, or it's just too hard to hold the position without compensating, it gives you some insight you might need to work on that position. The same concept applies for the lower trap test, where we're here like this, we put now our arm in this Y position, because if both arms were out like this, I would be making a Y, but we'll just bias one side. So you're in this Y position, not straight up, not out to the side, Y. Then from here, you go straight up and you hold this off the ground, and you just hold it for, again, that 30 to 1 minute duration. Now from here, if your elbow starts to bend or you start to drop down before 30 seconds or that minute, you know you might need work to bias the lower trap muscle. Working on shoulder internal rotation, a lot of times you'll see, just get in this position like the sleeper stretch and crank your shoulder into internal rotation, which could be a great stretch. However, if you lack that range of motion, it could be a very advanced one. So you want to regress it and modify by really targeting it in the back of the shoulder in a better position to then build up to, without getting in a compromised position. Because if you lack shoulder internal rotation and the shoulder hurts, by just cranking yourself in this position, if I were to sit up like this, I would be in this position, which is typically the irritant position for the shoulder when it's sparked up. So we want to stay out of this position in the short term and build up to this. So a good alternative for an exercise is something like this, which is the side-lying shoulder adduction eccentrics. This targets the back of the shoulder, which limits shoulder internal rotation. So I'm here like this. I'm gonna press up like this, so I'm below that impingement zone. And then from here, I'm just gonna slowly lower the weight down. You really wanna be on a bench where I can go past parallel. That will stretch the posterior capsule of the shoulder. Then I bring it back and I come up like this. Now the weight is gonna be very dependent on what you can actually tolerate. You don't wanna go incredibly high with this weight, because it's gonna be too hard for you. But you want enough weight to actually feel like your shoulder is working throughout this. And I feel my whole shoulder working as I'm controlling the weight down. What this does is eccentrically load the posterior capsule of the shoulder. Why eccentrics? Because that improves what's called sarcomeres in series. That increases the flexibility of the shoulder and of the muscular tissue and the joint capsule that we're trying to actually target. When we do this, I typically like to put eccentrics for 3 sets of 15 multiple times per week, so that you get input to this actual area. And then over time, the flexibility of the posterior capsule will improve. Now, we target the posterior capsule to improve internal rotation, because when we go into internal rotation, that part gets stretched. So if it's limited, it will be limited into this motion and compensations will happen. So by forcing yourself in a position like the sleeper stretch, too advanced. By doing a regression like an exercise like this to target the posterior capsule, you start to improve the length of it to then build up to more aggressive stretching. Now with this exercise, we're trying to bias the lower trap here with this. So this is the banded A row, where our shoulders are gonna be back, squeeze back, keep our arms locked out, and then we pull to the side of the body. We keep our arms locked out. We don't wanna bend them like this and pull like this. Shoulders back, elbows locked out, pull and hold. You'll feel the whole back light up. You could hold for a duration here, 3 seconds, 5 seconds, and then you come back. The idea with this is to bias the rotator, bias the lower trap, because when we're dealing with impingement-like symptoms, trying to raise our arms over our head and then work here would irritate it in the beginning. So this is taken from concepts that when you're lying face down and you do what's called prone shoulder extension, there's been some EMG studies to show that there's activation to the lower trap. Now, why is this important? We're taking the concept of that and applying it to here, because if we're dealing with issues, we apply the concept here to target the lower trap. It gets stronger, can act on the shoulder blade, and then tilt it backwards to open up more space to the roof of the shoulder, and it feels better. Versus forcing your arm in a position and trying to work it and just causing more irritation. So that's where this concept is applying for this one. So from here, we're up tall, shoulders back, squeeze, hold, and then come back. When we do this, I typically like to get more reps, 3 sets, 8 to 10 to 12, even up to 15. And I like to add a little bit of a pause here, so for more time on retention, versus just 1, 2, 3, like everyone else does and get no results. You want to get actual more tension to this and then come back. Hold, and then come back. When we start to work this one more specifically and keeping in mind the concepts and strategies to target the lower trap, in the long run, it could help the shoulder significantly. This next one, we're gonna target the rotator cuff through a range of motion to really bias the external rotators of the shoulder. This is important because it sets us up at activating and stabilizing the shoulder, so we decrease the impingement-like symptoms. So from here, we're not gonna do this classic one where we just do this for days on end. We're gonna go out and hold this position. Then from here, we're gonna punch the elbow forward up like this. And notice my forearm, it's staying perpendicular to the ground versus just caving in like this, going into that impingement, internal rotation, irritating position. You want to keep it here to really bias that rotator cuff because the band's trying to pull me, and then I come back down and then in. So now I'm working the rotator cuff dynamically and stabilizing it isometrically at the shoulder as well throughout this motion of the arm. So from here, we're really biasing that area much more effectively than we would if we're just going like this and using the delt muscle. Now, when done correctly, we don't need a lot of resistance here. Too many people do too much load, too much resistance, and they don't bias it because they call on higher level muscles. The weight and the resistance can be very, very low. This is like 12 pounds, and just doing those 2 reps, I legit feel my shoulder sparking up in terms of a muscular effort, working wise, firing. So from here, pull, hold, go up, perpendicular to the ground, maintain that, wrist stays stacked, come back down and in. With this one, I like to get more reps, 3 sets of 10 up to 15, to really bias it and burn it from a muscular standpoint. You do this repeatedly as well, start to have huge effects on the shoulder. I hope this video gave you insight and understand some things that you could do for the shoulder from a strengthening standpoint and a mobility perspective. When we do things like the upright row or raise our arms with the thumb down, we are predisposing the shoulder to impingement-like symptoms when it's symptomatic. Now, from this video, we know that lack of internal rotation can contribute to that. Lack of strength And activation at the shoulder blade can limit the space because it's the roof closing down. That can contribute to it. So when we zoom out and we focus on working on lower level strengthening exercises to really have an effect at the shoulder itself, and also working on mobility, you could see how that could play a huge role in the long run of exercising for long-term shoulder health versus just pushing through higher level activity exercises that have too much load, too advanced positions, and it can be this whole cycle of just ebbs and flows of pain and not feeling good and things like that. So we want to make sure we're addressing this more strategically. In this video, I went over two exercises from a strengthening standpoint and one exercise from a mobility standpoint. So I really, again, hope this gave you some insight. And if you did find value in this video, I would greatly appreciate it if you support my channel by subscribing down below, like this video, and let me know down in the comment section if any parts of this video didn't make sense, or if you want more feedback on certain things at your shoulder or another video. Let me know down in the comments. Again, hopefully this was helpful. This is Dr. Nick. I'll see you on the next one.